Regarding rheumatoid hand, what happens is that there is a synovitis and inflammatory cells in the joint, which causes penis formation, which then after causes deformity, lengthening of the collateral ligaments and deformities. The deformities which happened is basically a wrist radial deviation and supination, which causes prominent caput ulna, radial deviation of the fingers, causing subluxation of the extensor tendons ulnarly, which is stretching of the radial collateral ligaments, metacarpophalangeal joint flexion deformity along with subluxation, swan neck deformity and boutonniere deformity of the thumb, involvement of CMC joint, scapholunate ligament. So when I clinically assess this patient, I will check a pertinent history regarding pain, morning stiffness, symmetrical arthritis of the small to medium-sized joints. How is it affecting his daily living, like dressing, pulling up trouser, stockings, brushing teeth, hair, combing, and knitting. Reconfirm the cervical spine findings as well, and previous history of any medication which the patient is taking, for example, DMARDs or biological modifiers. Regarding the examination, severity level exposed till elbow, I will check for rheumatoid nodules, confirm my findings in the wrist joint, confirm my findings in metacarpophalangeal joint and the fingers, and can reconfirm and document the swan neck or boutonniere deformity. Regarding the feeling, I will palpate the tendon, the joints for the synovial thickening, and do a screening with the range of motion test. Flexor pollicis longus rupture happens with von Jackson syndrome. What happens is the flexor pollicis longus tendon is because of excursion injury at the level of scaphoid tubercle. Mellerfeld syndrome is the injury to the EDC to the tendons. Mellerfeld syndrome is flexor pollicis longus rupture, and extension tendon ruptured by von Jackson syndrome, which affects the ECU and then after EDC tendons, especially the ulnar side and then going towards the radial side. And I will check for neurological assessment of the patient as well to check for any neurological deficit. In deformities, it is important to remember the stage of arthritis. So for the arthritis of the fingers, we can classify it as nail buff classification. Type 1 is when there is a effusion and soft tissue swelling itself. Stage 2 is when there is a narrowing of the joints. And stage 3 is when there is penis formation, extensive cartilage loss, erosion around the margins, which is noted as osteopenia. And stage 4 is end stage arthritis when there is fibrous or bony ankylosis. Similarly, there is nail buff classification for the thumb. Type 1 is a boutonniere deformity with flexion of PIP joint and extension of interphalangeal joint. Type 2 is boutonniere deformity with involvement of CMC joint. Type 3 is a swan neck deformity when there is metacarpophalangeal joint extension and interphalangeal joint flexion. Type 4 is a gamekeeper thumb. Type 5 is a swan neck deformity along with CMC joint involvement. And type 6 is arthritis mutilans.